Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. I am your host, Karen Litzy, and we were on a little bit of a break. I was in Geneva for the World Confederation of Physical Therapy World Congress, which was amazing, and I've got some great interviews coming up next week from there, so stay tuned for that. But in today's episode, I'm really happy to welcome onto the program Dr. Ryan Lingor and Michelle Cummings. They both started pretty much from the ground up the Hospital for Special Surgery Ortho Injury Care Clinic. It's kind of like, well, we talk about it in the interview, but think of it as if you have a sprain, a strain, maybe a fracture, you don't want to go to the emergency room and wait all day. You can now go to this Ortho Injury Care Clinic where the physicians there are all orthopedic physicians and physicians' assistants, so you know you're going to get the right care from the right people. So a little bit more about Dr. Lingor. He serves as an assistant attending physician at Hospital of Special Surgery, faculty at Weill Cornell Medical College, medical director for HSS Ortho Injury Care, and team physician for the New York Rangers. Upon graduating from St. John's University in Minnesota, he obtained certifications as a registered dietitian, certified athletic trainer, and strength and conditioning specialist. He went on to complete athletic training internships with the New England Patriots and Miami Dolphins and was named head athletic trainer of NFL's Europe Hamburg Sea Devils. He graduated from medical school at Loyola University, Stritch School of Medicine, and completed his residency in family medicine at Illinois Masonic in Chicago and his sports medicine fellowship at the University of Notre Dame. He is board certified in family medicine and obesity medicine with a subspecialty in sports medicine. His previous experience includes working as an assistant team physician for the New York Jets, as well as several local high school and colleges. Now on to Michelle. Michelle Cummings graduated magna cum laude from the University of South Carolina with an undergraduate degree in exercise physiology. During her studies, she spent 3 years as an undergraduate research assistant, working on a study which focused on implementing health and nutrition programs into churches. Michelle then earned her master's degree in physician assistant studies at the Massachusetts College of Pharmacy and Health Sciences. Prior to going to HSS, she worked as a PA for private orthopedic and sports medicine practice, focusing on upper extremity injuries. So we have two really great, well-informed orthopedic clinicians. And in this episode, we talk about the unique offerings of the HSS Ortho Injury Care, expanding patients' access to quick and affordable medical care, which who doesn't want that, how to market your services and gain trust with your community, and so much more. So a big thanks to Dr. Lingor and to Michelle Cummings, and everyone enjoy today's episode. Hi, Dr. Lingor and Michelle. Welcome to the podcast. I'm really happy to have you guys on today to talk about the HSS Ortho Injury Care. So thanks for coming on.
Thanks for having us.
All right, so let's start from the beginning. All right, so what is the goal of this new clinic? What is the why behind it?
So HSS has always been a good place for orthopedic and sports medicine conditions. One of the problems that we've had at the hospital is getting appropriate access early on when patients need to be seen. So our providers tend to be pretty busy. So what we want to do is create a resource for patients to be able to go for their acute sports medicine and orthopedic needs.
And so that takes me to the next question: is why sports medicine over other specialties? Where did you, I mean, obviously there is a hole to fill, right? So why this over others?
For myself was just I really enjoy helping keep people active, and I think somebody's activity correlates with their quality of life. And so if we can help people when they get injured, it's something to hold them back from being active on a daily basis. that's kind of where I wanted to help out.
I think for me it's twofold. One, because I'm so passionate about sports in general. And secondly, the specialty itself, you can actually make people better a lot quicker than in other specialties. So that's what drew me to sports.
Yeah, then I agree. I think with those sports injuries, I know coming from the physical therapist perspective, you kind of see this progression, right? So regardless of the age of the patient, you kind of see from injury, and you can really follow them through to recovery, which is really exciting from my standpoint. And now, what are the commonly treated injuries seen in the clinic?
So we see all sorts of musculoskeletal and sports medicine injuries. Some of the most common stuff is if somebody has a shoulder after an injury or just a worsening shoulder pain. We see a lot of knee injuries after skiing and other athletic events, hip pain of all sorts. So any of the extremity injuries we do specialize in. And for patients that have back pain, fortunately, we are suited at HSS to have a back pain clinic, so we direct those patients to the right place.
And so why should a patient come to this sort of ortho care clinic versus going to the ER? What is the difference?
So the difference, the ER, you always have long wait times, and they're not always apt to treat just orthopedic and sports injuries. So here we have an x-ray on site, so quick access to films, as well as splinting and casting availability here. And what's nice is you can actually schedule appointments online or call directly, and we schedule same day and next day appointments. So if a patient sprains their ankle, a night at basketball, they can go on and schedule an appointment early the next morning. So to try to shorten the wait time to the ER.
And what types of, so you alluded a little bit to the splinting and casting, but as non-operative clinicians, what types of conservative treatment are you providing for these patients as they come in?
So a lot of the stuff, fortunately for us, most patients just want to be checked out to see if they have something that they need to be more concerned about and kind of be directed in the right area. And fortunately, we're kind of at a good position to get them access to all the resources that we have at the hospital for special surgery. For those patients that need for stuff that we can take care of in the office here, we do have, as Michelle said, the X-rays. We have ultrasound. We can do injections into different areas as necessary, and we have the use of ultrasound to make sure that we are optimally accurate with the injections and the care that we're providing.
And so how new is this? It's pretty new, right? A couple months? When did you guys first open?
Yeah, we first opened in November of 2018, so it's been a couple months now.
And as with everything new, every new venture, right, it has its ups and downs. So what are some of the challenges that have come up since this clinic opened?
Well, the biggest challenge is just getting our name out there and letting people know that we exist. We've been very fortunate to have a lot of interest, both in our hospital and in the community, to get people in the door when they need to be seen and get them moving in the right direction. So there's been a lot of positive energy that we've been able to benefit from in our first few months, and we're still working out some kinks, and not everything is smooth as you mentioned when we first get going. But fortunately, we've been very blessed to have a great staff around here that are all interested in doing what's best for the patient and providing exceptional patient care.
And so you have some challenges. I'm sure there's also been some pros, right? So what have you found since opening the clinic have been a real positive, or maybe even things you didn't even expect?
I think one of the nicest things is that our patients generally are in a pretty good mood when they come here, because they're oftentimes patients, they're looking to go to the ER and they anticipate waiting for a couple hours and may have you be told to follow up with their orthopedist at that time. And so patients are excited when they come to a very reputable hospital and then being able to get an appointment the same day or the next day. And so they're pretty excited about that opportunity. And so it's just kind of fun to work in that kind of environment where patients are in a good mood off the bat.
Yeah, that sounds amazing. And I would also have to think that, when you go, if you have an orthopedic injury or like you said, a soft tissue ortho injury, and you go to the ER, you're not guaranteed to get an orthopedic specialist to treat you in the ER. Would you say that's correct? So is that how this kind of differs, right?
Yeah, that's exactly right. If you have, if you go into emergency room, they have the resources for, taking care of the life-threatening or really serious things, and that's perfectly appropriate for the ER, because we don't treat those sort of things. But with patients that go to the ER and have a lot more of the 90% of the orthopedic injuries, that's where it's appropriate for us. And so it's a way for us to cut down on patients' wait times, on their costs of an emergency room bill, and getting them moving in the right direction right from the beginning.
And do you guys take insurance?
Yeah, we accept most insurances, and it's actually listed on our website. So if patients had questions about the insurances we take, it's all listed on the website, but we take all major insurances.
And that's pretty easy to find. If you just Google HSS Ortho Injury Care, you'll see it pops right up, and you can see the insurances that we take, and you can book yourself online, and really booking an appointment is about a 3-minute process.
Nice. And then is this something that you patterned after? Like, is there another clinic like this somewhere else in the country? Or is this one of a first of its kind clinics?
To our knowledge, this is one of the first ones in the region. I think there are a lot of other orthopedic places that have walk-in clinics and stuff like that. I think this is it's the first standalone clinic that operates kind of how we do, and it was just again something we saw as a need, and it's been wildly successful in our first few months,
which is amazing. Now, Dr. Lingor, I have a question for you. So aside from being a physician, orthopedic physician, you also have a nutrition background, which I find really interesting. So are you able to infuse any of that within this clinic, or do you see that as maybe something that you might want to infuse into in the future?
Well, with the sports medicine and medicine in general being a field, and nutrition in its entire other field, it is something I really enjoy learning about and trying to keep up with. In the clinic right now, it just helps me to better counsel patients and answer questions that they have about nutrition and things that they can do to help them optimally heal and prevent some of the chronic conditions. And so I utilize it that way. And fortunately at HSS, we do have a nutrition and dietetics team that we call upon, as well as physicians who specialize in nutrition. We need more help. So it's not, I don't solely practice in the field of nutrition now, but kind of more as a complement to what we offer at the clinic.
Yeah, I think that's great. And so you just started, you're open a couple months. Where do you see this going? Where do you see this, that old question, where do you see this going in 5 years?
Yeah, so we're kind of looking at the Hospital for Special Surgery as branching out to a couple different other sites around the city, as well as a couple places throughout the country, in Las Vegas and in Florida. And so we're looking at kind of making this, this being the flagship, and then in this kind of model after other places, just because it has seemed to do so well for our patients and for our physicians as well, to get patients in. So by that I mean that when patients call other doctors' offices and they can't be seen, those to us, and then if necessary, then we get that patient back at an appointment that's a little bit more expedited than what the other physician would have been able to originally see them.
Yeah, so you're sort of like, So the patient can come into you guys, and if you feel like a referral is necessary, then you can kind of help streamline the process for the patient, which is amazing for patients because that's what they want, right? Because they come to you, they don't know what's going on.
Yeah, that's exactly right. And oftentimes when they call one of our surgeon's office, it may be a day that the surgeon just happens to be in the operating room. And, regardless of how bad they want to see that patient, they just don't have the ability to get them in. So that's why I always say that we're here when the patient needs us and kind of get them moving in that right direction.
And, in looking on the website, you have Michelle, a physician assistant, and then a couple of other orthopedic physicians. How do you guys all kind of work together to make this clinic run?
That's a good question. So Dr. Lingor is here more than anyone else as the medical director. So he's here usually 5 to 6 days of the week. We are closed on Sundays. And I come in later in the morning and cover the night shifts. And then we have the other providers that will cover sometimes on the Thursdays and also on Saturdays. So they cover in the need to fill in the gaps.
Got it. And from where you are now, then from where you started, I mean, you obviously see this as something that's sustainable, right? Because I think a lot of people, when new things kind of move into their communities, they're always a little hesitant. So what do you do for the community? And New York City is a big community, right? Like you said, getting the word out is part of it. But do you have any plans or on kind of being part of maybe even smaller communities? New York is gigantic. But really kind of getting into the community to get people to trust.
Yeah, I think that's a great point, and that's one of the things that just in our area, we're located on 65th Street and 2nd Avenue, and so we see a lot of patients just in our area with a few block radius of patients walking by who have seen the signs a little bit and then come in and check it out to see what it is and say, oh yeah, I have this knee issue. I was wondering if you guys can take a look at it. We do welcome walk-ins. We don't. We prefer patients to make an appointment just to decrease their own waiting time, but we do see a lot of that, and just providing that access to patients when they need it, I think has really helped build our name in our own little community that we serve right now.
Yeah, because that's for me. That's I have my own practice, and that's always the hardest thing. Like you said, is getting the word out, letting people know you're there. And so, what other I guess, marketing things have you guys done that you've found successful, so that if people are listening, they're like, wow, I really wish we had something like that in our community. Maybe they want to start it. What would your best advice be?
Well, one of the things that we're some of the fortunately, New York City has a plethora of sporting events around, and some of those are being open during those times. So, like for instance, when the New York City Marathon is going on, on that Sunday, we'll be open that day to provide access and for, again, people in the area, just to kind of get our name out a little bit more, that people are walking by and having, welcoming people in if they need to be seen by one of our providers that day, and not, don't anticipate that for the runners because it's, they're a little busy that day, but
right.
Fortunately, yeah, exactly. Hopefully not too many of them. But we are just one block off the race course over there. Advantage of some of those special events and volunteering with those groups is something that we look forward to.
Yeah, so kind of making partnerships within the community so they know you're there and they can refer to you and all that fun stuff.
Yeah, so we have several of our physicians that do volunteer in past years with those events, and so we see when patients come in, for the Marathon Monday that they host after the New York City Marathon, those patients they're seen by medical professionals that day, and if they need to get further testing done, we can provide that access to people.
Fantastic. I mean, it sounds like you've got a great niche over there, and that you've definitely found, a way to kind of plug that hole, right? You found a way. You saw this sort of lack of of accessibility and have made something a lot more accessible. So is there anything that we missed or anything that, you want to, the listeners to kind of remember about the clinic?
Yes. So just to reiterate, if as patient things come up, and unfortunately, musculoskeletal injuries, they're always come up unexpectedly at the worst possible times, and there's a lot that can be done if when patients have that time of need, whether they're going on vacation or have major life events. That's our primary goal is to provide access for the patients when they need it, and help them sort through some of the frustrations and difficulties that come along with musculoskeletal and sports injuries, and get them back to the level of health and quality of life that they're used to enjoying.
Awesome. And Michelle, how about you? Anything that we didn't touch upon, or any closing thoughts that you want to share?
No, I think just thank you for having us on the show and helping us get the word out. It's very helpful from different aspects to get it out, the word out in New York. So thank you for having us.
Yeah, you're welcome. And, I think it's also important, like now as a physical therapist, this is great for me to know, because because we see patients directly now. So if someone comes to me and I'm not sure, then for me, it's great to say, hey, here's this, there's a clinic that specializes in this. And then what it does for me is it kind of builds up my credibility with the patient, because I'm sending them to a place where they're going to get the help that they need.
Yeah, Karen, we're really excited that the physical therapists have the direct access through the physical therapy, and find that the physical therapists that we commonly work with, it's been a great relationship with that. So we look forward to expanding on that. And I also thank you very much for having us.
Yeah, my pleasure. My pleasure. Thank you so much for coming on. So again, if you want to find out more information, you can go to hss.edu/ortho-injury-care. Is that right?
That's correct.
I think that's
easiest.
it. Yeah.
Yeah, you got it. The easiest thing is just go to Google and type in Ortho Injury Care, and it'll help.
Yeah, or you could do that. Or you could go to podcast.healthywealthysmart.com, and we'll have the link right there for you. So you can just click on the link and go right to it. And, hopefully we see more and more of these types of clinics popping up around the country, because it certainly does fill a gap. So thank you guys for all that you do to help people with sports injuries, musculoskeletal injuries. So thank you.
Thank you, Karen.
Likewise. Thanks so much.
And everyone, thanks so much for listening. Have a great couple of days and stay healthy, wealthy, and smart.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.